and healthcare advocate. Okay, recording. And thank you for inviting me to present the results of our recent healthcare survey that we did in La Plata County.
Great. And shall we go ahead and begin? Shall I share my screen?
Yeah.
Great. Sorry.
Great. Oops. Okay. All right, let's see. Thanks so much, Beth. So I'm hoping that this presentation may stimulate some of you to go back to your leagues and conduct a community survey. I feel like the more data we have, the more results and data we have can only increase our advocacy for improving healthcare locally and at the state level. Leagues work to provide millions of Americans across the country with objective information about major policy issues through education. This includes organizing community education projects, holding public forums and debates, creating and distributing resource materials, and engaging community leaders and policymakers. Our healthcare committee this year, or last year, 2022, chose the healthcare survey as our community project in 2022. Next slide. Our survey was designed to focus on these areas: demographics, what were respondents' ages, income, education level, and race. And we asked specific questions about respondents' experiences, their opinions, satisfaction levels with local health insurance, with costs of healthcare, local providers, and hospitals and prescription drugs. And finally, we wanted to get an understanding of where people stood on various approaches to healthcare reform. Next slide. So in March of 2022, we began a series of listening conversations in informal settings throughout the county and developed an anonymous online questionnaire. And it was available in both English and in Spanish. And it took about 5 minutes to complete. The survey was self-selected, meaning those who were willing to fill out a survey. And participants were reached through flyers, social media, email campaigns, press releases. We set up tables at the farmers markets, Durango and Ignacio, another nearby city, their libraries. We facilitated group discussions with local service organizations, church groups, city and rural group gatherings. The surveys and discussions ended in September, so it was a 7-month process. And we got about a total of 546 responses. Interestingly, though, we received hundreds of additional and often heartbreaking comments in an open-ended text field, which was part of the survey. And this lent a much better understanding of perspectives and experiences, adding deeper texture to our results. And the state of Colorado conducted a statewide survey in 2021 titled, "How Coloradans Feel About Affordability and Healthcare Reform." They had a total of 872 respondents for a state of over 5 million residents. And I'll include some of their results where we overlap to give you a statewide perspective compared to our county. Next slide. So as you can see, the demographics, although we attempted to get a wide cross-section of our county. 68% of the respondents were over 60 years old. And this is considerably higher than the county census. The census was only measuring 65 and older, so we've got 4 more years in our survey, but we were only 18% for the census, so we're considerably higher than our county census. Roughly 1/3 of the respondents were under 60 years old. 40%, as you can see, reported incomes of over $100,000 or more. About 60% reported incomes at below 100,000 or below. And just to give you an idea, our county census reports a median income of $69,000 a year. 80% of our respondents had a 4-year college degree or higher, showing a fairly high level of education. And race, in the bottom right corner, was predictably better alignment with our consensus as well. We had 92% white respondents, and in our county, it's about 88%. So we weren't too far off, including the Hispanic, Native American, and other people who participated. So we can reasonably assume that retired, educated people in the county have time and interest to fill out a survey about healthcare. They may have more frequent interactions with the healthcare system and are more willing to speak about their experiences and concerns. Next slide. 51 of the respondents were on a public plan, meaning Medicare, Medicaid, VA, Indian Health Services, and 46% of those on public plans were on Medicare. So that is a substantial number of the respondents we received. 47% had private insurance. So if you combine both the individual plan and employer-sponsored plan, those were the ones on private insurance. And so that was a fairly close or even split between public and private. Next slide, please. So looking at health insurance, overall, about 73% of the respondents were moderately to extremely satisfied with their health insurance. However, when we broke down the results by insurance type, 70% of the people who reported the highest satisfaction with their coverage were on either Medicare or Medicaid. 65% of the lowest satisfaction scores were from those who were on private insurance. Next slide. So we're looking at the most frequently cited comments. So this wasn't in the survey with the numbers, but the comments that we read from the survey about health insurance were the excessive complexity and confusion. 41% of those people receiving bills for unforeseen costs, just sort of out of left field. Restrictions of coverage was a big concern. Lack of primary care providers accepting Medicare and Medicare patients. And what we're learning is for a lot of the independent primary care providers who don't receive the amount of Medicare reimbursement that the hospital would, they can barely keep their doors open and their lights on with just accepting Medicare reimbursement. So a lot of them are dropping patients with Medicare, which is a real big concern in our small area. And then billing confusion and errors was a big comments often. Lack of price transparency was hard, and poor or inaccurate billing information, especially in advance of a procedure. People were feeling like they were really just flying blind, going in for help or a concern and then not knowing what kind of a bill they'll be receiving. But a critical note that I want to bring up for all of you is considering that our respondents were older, more economically secure, and highly educated, even they are still struggling with our local healthcare system. And I'd like to read to you, if I may, a few of the comments about insurance and just the cost of healthcare. These were some that we sort of picked out of the hundreds of comments made. One was, before a recent procedure at Mercy, that's our hospital, our critical care hospital, I was called in advance and told how much I would have to pay for a procedure at the hospital that wasn't covered by my insurance. I was told there would be no other charges other than the amount I was quoted. I was assured again, when I checked in at registration, there would be no other charges. And I specifically clarified that there would be no additional charges for the radiology services that sometimes blindside people. Several weeks later, I received a separate bill from the radiology group. Another one, visited the ER, did not see an MD, was there for 20 minutes, no scans, no tests. My out-of-pocket bill was $2,500. Another comment, it drives me crazy that health insurers determine which tests they pay for when my provider has a medical reason for me to do the test. There's a lot of frustration out there. And then the last one I'll read is, with a $7,000 deductible, I have postponed several critical diagnostic tests past mid-year. And they listed MRI, cardiac stress test, echocardiogram, pulmonary function test. And then their follow-up is who has $7,000 a year to pay for these things on top of almost $10,000 in premiums. Next slide, please. So I think the problem with too high costs has a far-reaching result, and that is delaying care costs us. And it's notable that among the respondents with private insurance, 58%, and to me that's a really big number, with private insurance delayed seeking care. Conversely, only 37% with public insurance delayed seeking care for cost reasons. And just so you know, as a comparison, the Colorado statewide survey similarly recorded 45% of all Coloradans have put off recommended medical procedure or treatment. And the state survey also said that 66% of Coloradans are not confident that they can pay for healthcare services, such as an ER visit or hospital bills in general. And there are impacts of not seeking care. There's a rise in chronic disease, a corresponding increase of incidence and severity of chronic conditions like diabetes, cancer, and cardiovascular disease that we know are just impacting almost every community throughout the country, but we, definitely in Durango and in smaller rural areas, it's awful. And then what a lot of people don't think about is the economic impact of not seeking care and being unhealthy. When workers are too sick to work, then families starve. Economies need people to work, so there's a built-in incentive for a healthy economy to make sure everyone has access to health care. And then there's social determinants of health, which I'm sure many of you, especially in the healthcare arena, have heard over and over. And those of you who are working in improving mental health or behavioral health, any area is health related. But poor health is a major cause of homelessness. The loss of employment due to poor health then becomes a vicious cycle. Without funds to pay for health care, whether it's treatment, medications, or surgery, you can't heal to work again. And without income, you lose your home. So many of our counties and areas in our state are struggling with the homelessness problem, or for the unhoused, what do we do? And then it turns out, of course, a lot of the emergency room visits are people who don't have health insurance, that use urgent care or an emergency room as their usual place of care. They don't have a primary care physician. So what happens, that adds additional strain and cost to hospitals, who then pass that on to us in higher prices. In fact, in La Plata County, we have about 11% who are uninsured according to the 2020 census. So that may have gone up substantially in the last 2 years. And then medical related bankruptcy. A few words on the problem of that is, although we don't have local data because that wasn't part of our survey, we received concerning comments about medical related bankruptcy. Nationwide, over 100 million Americans, that's 41% of our population, are in healthcare debt, meaning they've got some healthcare bill on their credit cards or that they're paying off on. And it is the single biggest cause of personal bankruptcy. There's close to 1 million individuals, or about 530,000 families, that file for medically related bankruptcy each year due to healthcare bills, and 80% of those people have insurance. So I think this demonstrates how our healthcare crisis has merged into an economic crisis. Healthcare remains one of the most pressing sources of financial insecurity. Next slide, please. So then we looked at a lot of the comments regarding our local healthcare providers and hospitals. Our respondents generally expressed low to moderate levels of satisfaction with the local hospitals and physicians. However, the quality of the physicians and hospitals received the highest moderate to high ratings. So that was an interesting component. The availability of hospitals and physicians and the length of time to get an appointment received absolutely the lowest rating of all of them. And that reflected 80% of our respondents. And a common point was made in the comments was the concern for accessibility to a full array of healthcare services. And many mentioned needing to fly or drive elsewhere for specialist care. And we definitely have a deficit in La Plata County of not only primary care physicians, but of specialty care. And there is a group locally working on improving that and working with the hospital about it. But I went ahead and spoke with a few physicians who had recently retired or quit the hospital. And actually one of them has their own independent direct primary care practice totally away from the hospital. And I asked him why he left the hospital, what were some of the problems he encountered. And he said, and I'm hoping I can read this to you, that the current employee culture and environment was one of the biggest reasons why he left. He said there's such an emphasis on aggressive speed and high patient volume over safety for the patients. The hospital's preference for lesser trained, cheaper medical providers and clinicians was another reason. And he said some of the treatment protocols that the hospital had, he felt was unsuitable for certain of his patients. And that was brought up by a few of the people I asked about it. And then this one was a surprising one to me, is coding bills high or upcoding, overdiagnosing, which you know is happening with ACO REACH also. But he said they were encouraging the doctors to do that to recover dollars per visit. And one doc said he felt like he was part of the problem, putting his patients into medical debt. So in essence, physicians are often being forced to violate their Hippocratic oath by not being allowed to follow best medical practices for their patients' well-being. And then, as we talked about a little bit earlier, and possibly before some of you all came on, was women's reproductive services. And our survey had ended before we found out in October that our local hospital run by Centura Health was halting tubal ligations at Mercy. And the League of Women Voters' position is that reproductive care is essential health care and a fundamental right. Taking away reproductive decisions strips women of their personal autonomy. And just so you know, women compose about 49% of our county, 49.6%. So it remains to be seen what the long-term impact will be on this decision. And we feel pretty strongly about pursuing this concern, this healthcare concern. Next slide, please. So prescription drugs. And I was a little surprised at this one, that the level of satisfaction with the amount paid for prescription drugs had an interesting level of satisfaction and very satisfied. And here's where I think we may see the effect of higher income and Medicare respondents to the survey. But further clarification in the comments by respondents stated the most commonly mentioned frustrations with prescription drug prices were cost of drugs, and the wide range of price differences for the same drug, depending on what pharmacy you go to or what insurance you have, and the confusing insurance policies regarding drug coverage, if you're even covered with that drug or not, or if it changes mid-year. Okay, next slide. We're almost there, you guys. Okay, healthcare reform. And this really surprised me a lot with a lot of the respondents that we had. 77% of the respondents agreed that universal healthcare system should be established. And this actually mirrors the statewide data found. They saw that 58% of Coloradans want a national healthcare plan, or they stated Medicare for all. And then an overwhelming number, I thought 87% of our respondents in our county felt healthcare was a human right. 61% of Coloradans in the state feel that everyone, this was worded a little differently, regardless of immigration status, should be able to get affordable healthcare coverage in the state. And then 69% locally agreed that Medicare should be available to those 50 years and older. And that's also where a lot of the premium rates and deductibles tend to skyrocket, and people really feel the pinch just due to age, not a worsening healthcare problem or a disease state, but just because of age. And then 73% of our county respondents felt healthcare should be a nonprofit industry. A local respondent commented, healthcare should not be treated as a financial asset to be maximized. It's a public good. And I thought that was a phenomenal quote to share with you all. Also, 70% respondents thought the US government should finance healthcare for all citizens, and 82% agreed that government should be allowed to negotiate drug prices for Medicare. These are huge numbers. And that's why I think these surveys are really important, just to get these numbers when legislators are worried that they're going to say or promote the wrong thing. I think this is important for all of us to get a hold of this. Okay, the next slide, please, Beth. So, although our population demographics were certainly skewed in favor of an older population, when we slice and dice the data to look at younger respondents, we still come to the same conclusions, that the primary problems we're facing in La Plata County and probably everywhere is complexity. So how do we improve our ability to efficiently deliver healthcare including price transparency, insurance coverage, billing practices, shared and secure electronic medical records, just to name a few. And then the problem with affordability, what can be done to address the fact that La Plata County has among the highest hospital and insurance prices in the state, let alone the nation. And I don't know if you're familiar with the study that was done probably about 4 or 5 years ago. Colorado ranked as having some of the highest hospital prices in the country. And that included California and New York and some of the larger states, but price per patient, we were skyrocketing, and we're the healthiest state in the country. So it just doesn't make sense that this is what's happening to us. And then accessibility and availability. Are we recruiting and retaining enough providers for our growing population? And what is being done to monitor it on a county-wide level, and I'd say even the state level? How do we ensure that we have enough providers of in-demand healthcare services, women's reproductive services, end-of-life care, primary care, disease management, preventive medicine, which you don't really hear a lot of these days, behavioral health, and public health? So clearly there are no simple solutions to these problems. Communities like us all across the country are wrestling with the same issues, and we can learn from each other. So working together is at the heart of making meaningful change. Every community is different, and as a result, efforts to improve healthcare will vary. However, there's one constant, and that is when people work together with a shared vision and commitment to improve health and ensure everyone has fair and just opportunities to thrive, it can yield better results than working alone. Individually, by county, whatever, we've got to really work together. So I'm hoping that the results of our survey will catalyze and inform local and state legislative decision-making and increase oversight throughout the whole healthcare system. Our league happens to be actively engaged right now in forming a community coalition with other organizations, the public health department, local businesses, business leaders, and other community stakeholders. The goal would be to address and agree on possible solutions and create an action plan to implement policy to alleviate the difficulties, restrictions of services, and other concerns. So I hope all of you will consider offering a healthcare survey in your community and then bring the results to your leaders, politicians, and at the state level, and hopefully our League of Women Voters State Action Committee. Combining all of our efforts is how we may be able to affect change. Grassroots and then combining all of us is how we're going to make a difference in the state of Colorado. So thank you for letting me share our results. And if time permits, I'm open to answering any questions or having any type of discussion you may enjoy.
Great. Thanks so much, Jan. Wow, that's really impressive. Okay, I see one hand being raised by Kathy Winchester, and then Hope is next. And you're still muted, Kathy.
Thanks, Jan, for the hard work. And I'm one of those physicians who is part of that group that is trying to make changes. The big issue in Colorado, the reason the cost is so high is because we have huge rural communities, and hospitals used to be able to take care of everyone. Now we're all funneled, all of our patients are funneled via planes and helicopters to Denver or Colorado Springs. Bad idea. $50,000, $60,000, $70,000 for a trip one way to be told you have a bleeding hemorrhoid or you don't have chest pain, you have indigestion. A lot of the physicians in these small communities have quit because of the big healthcare gorilla. And that's Centura, that's Kaiser, that's all of these organizations that come down, and the bottom line for them is the dollar. So for those of us who have tried to take care of patients successfully, and we have before I retired, you cannot find anyone who come into these communities because of the fact these big health organizations have bad reputations. Young doctors don't want to come in because they don't want to be on call. Therefore, there's no primary care, and all these patients use the ER like a primary care. So I understand the issue of the cost of an ER, but people need to get, if they want to go to universal health care, your biggest thing will be you're going to take away benefits from people. You go to universal health care, they're going to be told you can't go to an ER unless you have these conditions. The dollars have to go down. And when you start taking away things from people, like Mercy has taken away tubal ligations, you have to understand why they did that. They're a Catholic associated organization. So if the county doesn't like this, buy the hospital, get somebody else in here to own the hospital, and then you'll have less people who are being told you can't have this service or that service. So bottom line is, it's really hard when you have such skewed demographics. If you had a statistician look at your demographics, they would tell you right off the bat, it's very skewed, that you don't have representation of the underserved, the homeless, the working moms. You don't have adequate representation. You just had your Medicare group. And those of us who are retired, who live in Durango, have an income that is substantial. You have to have an income to live in a destination town. So bottom line is, we need to get better data that represents the entire group. And if you go to the reservation, we have huge reservations around us. You would have a completely different data set. So that has to be included in our patient population. It's just it's a very hard demographic to get to unless you have social workers and the healthcare service go out and give these questionnaires to people and actually sit down and read to them, because half of those people don't read English or they don't understand. So having lived in this community for 20 years and worked as a physician and a cardiologist and an interventionalist, we did everything. Now everything is being shipped off. So you understand why healthcare costs are driven so high. And they send everyone to Denver rather than a 45-minute flight to Albuquerque. I mean, it makes no sense. All of this makes no sense, but this is the hospital and these big monster organizations who call the shots. They're told you cannot send anyone down south to New Mexico. You have to put them in a fixed wing aircraft and send them up to us. None of this makes sense. That's why this group of physicians have gotten together, and we're trying to get Centura Health to understand. Centura is up in Colorado Springs and up in Denver. So we're trying to let the big 900-pound gorilla to get them to pay attention to rural healthcare.
Right. Thank you so much. I really appreciate your input on that. And one of the things that I didn't mention is that we're planning on bringing this presentation and survey out to a lot of the areas you're talking about now and getting feedback from them, because we know it was somewhat skewed. But even if you think about, these are the people with money. These are the people who are on a public health plan. You know, Medicare is so much better than a lot of the private plans, and they're still struggling. So yes, even though a statistician will say, you didn't get to a lot of the people who are really
Service
suffering
in
and
your
struggling.
community.
It's not going to be a whole lot better than what we had with the wealthier and older people on a public plan. So I hear your concerns. And I think, again, if we come together, if as a community, and the local retired physician group is definitely going to be part of and has been part of the Catalyst group, I think we have to coordinate efforts and not just one alone trying to make changes with
Yep,
our
you-
hospital
You're
system.
standing there getting beat up.
Mhm.
Yeah.
Great. Hope.
Jan, I want to thank you so much for the survey and actually running through everything. That was very, very helpful. One thing that stuck out that you had mentioned is that there was a physician that left Mercy. And I do live in La Plata. I actually live in Bayfield. And that they ended up opening up their own physicians group or, PC or primary care private group, and that they couldn't take Medicare patients. And then at the very end of your survey, you had mentioned that a lot of people want to go to Medicare for all. So with that said, there is going to be a cost, but if we go to a Medicare for all, not a lot of us are going to be able to have healthcare access. Nobody's going to get paid. Nobody's going to be able to get any of these like MRIs or CT or anything like that. I know working in medicine that Medicare and Medicare actually sets the standard for the cost, but we actually need to look at it in a different aspect is if in fact that primary care could not even see Medicare patients, if we Colorado ended up going into Medicare for all, holy cow, not a lot of us are going to be able to even get to see a primary care because they're going to all go to, what is it, consult, where they do pay, what is it?
Rebate.
Somebody.
Rebates.
Yeah, thank you. The other thing I have to say is, in looking at this, I've been in healthcare for 25 years, not as a nurse practitioner, but as a nurse working at the bedside, then became a nurse practitioner. When the Affordable Health Care Act ended up coming into effect, I noticed that it actually increased rates almost 192 or 129% from, actually it was 2013 to 2019. That was just for the working people, and that was because there's all of these mandates that ended up having to be encircled in all of these insurance companies. So they're having to pay, like, again, I don't have children. I chose not to have children. So I'm having to pay for like OB and all that stuff. And I understand that needs to be part of some form of healthcare for some people, but we took away all of the things that people can start choosing. And I agree with what Dr. Winchester mentioned. We live in a rural healthcare area. We live in a rural area where there is farmers. People are not going to go in because they have chest pain, and they cannot afford this. So when the Affordable Health Care Act came in, now people cannot afford because it took away the affordableness of those healthcare. I mean, we're really stuck in a pickle right now, and I truly do not believe that Medicare for all is going to be the thing that we need to do. Maybe, have different, insurance coming back into Colorado, looking at that. But, that's, as somebody who has worked at the bedside, it is not something that we really need to do. Going back to what Canada's doing right now, people are waiting many, many, many months.
Thank you, Hope. I really appreciate your perspective on that. And the one thing I'm going to just throw out there is when they say Medicare for all, that's kind of become a misnomer. It's not Medicare as it exists now. Medicare does not pay the rates it should be paying. And so when anyone talks about a single payer program or Medicare for all, they're talking about raising the rates to be affordable so doctors can keep their lights on and their doors open. It's not exactly what we're seeing today. I mean, the government is paying more to doctors in hospitals than in private practice, and that doesn't make sense. And the direct primary care physician that I spoke with, who left the hospital, accepts Medicare patients. A lot of the patients don't want to come there and pay a monthly fee on top of their Medicare. So that's where, if we combine it all and not separate and have different strata of healthcare for Medicaid, for lower income people, elderly people, but pool everyone together with maybe even an all payer rate that's just across the board with maybe some minor tweaks, we can cover everyone. We're paying 60% of all healthcare now in our public plans. 60% would cover everybody, and then add a little tax or income tax or something on top of that to fit in the other 40% or 35%. And we could have incredible coverage, very comprehensive coverage, and including all the MRIs, echocardiograms, and all of that. And it would be substantially less than we're paying now. You wouldn't be paying for profits that we find in health insurance companies. You wouldn't be paying the unjustified prices that pharmaceutical companies are paying. So there's so much waste and so much money that could be recouped if it were really evened out, smoothed out, and we're paying for healthcare. We're not paying for profit centers. And to be able to keep hospitals open, 180 rural hospitals closed in the last decade. And I am nervous as heck about our area, even though we're fairly well compensated and funded with all the private insurance dollars. But to me, I don't want to wait till we have nothing, but start working now and getting the community together to say, what changes, what solutions can we have?
Get rid of Centura.
Advocate, that tell people their rights when they go to the hospital.
It
Or
is.
what they can ask if they have a low income, not to be charged the full amount there.
They're
People
not
just don't
charged
know.
the full amount. If they don't have insurance, or if they're under the poverty level, they call the hospital and they say, I'm a cash basis person. And that takes the price down 70%. So you've got an MRI that you bill you or me or Medicare for $7,000, and the cash paying person gets charged $1,200. It's you and me and everybody else who's paying that extra so that this person can get the cash price. But you're right, healthcare is out of control, and it's out of control because of the big healthcare organizations who are making money.
Okay, we have about 2 minutes left if we do want to keep this to an hour. I'm wondering if Elaine would like to chime in. Don't mean to put you on the spot, Elaine.
Yes, there is financially, there have been so many studies done that do show that a single payer type of program financially is benefits. You save money and you cover everybody. And there really are, there are lots of reasons why that type of program would be beneficial to everyone.
Marilyn.
Yes, I just want this whole thing, that kind of idea also applies to the drugs. Yesterday, I have a drug that I need to have, and I also carry D, I have the drug plan for Medicare, traditional Medicare people. And I went in and he said, oh, it's going to be over $100, $120. And I almost, fell on the floor. And I said, well, I'm going to pay cash for it. Guess how much it was? $26.
See? Mhm.
Hmm.
Yep.
You know,
Yep, it's sad.
Mhm.
it's,
Okay, we're at 6:30 now. I would like to really thank Jan Phillips and the entire La Plata team for their work on this survey and for taking the time to present it to us. I certainly agree with you 100%, Jan, that a collective voice rings louder, and in any way that we at LWVCO can support, please don't hesitate to let us know. The next meeting of this task force is scheduled for February 7th. We don't yet have a strong direction on that meeting. So if anybody I mean, we can continue this conversation. I kind of feel like I'm cutting it short. There's certainly lots to talk about here. We do have related a gun violence prevention presentation next week on Wednesday with Representatives Andy Bosenecker and Elizabeth Epps.
That's the 18th. It's on the
It's
18th.
The 18th, thank you. They will be presenting a mass shooting prevention act in the legislature very shortly, and they will be talking about that. I feel pretty confident that you all agree with me that gun violence prevention is certainly a healthcare issue, as well as reproductive justice. For that reason, our gun violence prevention and reproductive justice task forces are officially subcommittees of this one, which means absolutely nothing except in principle. They have all the authority of every other task force. It's just making the statement on principle.
Beth, have you considered bringing in a hospital CEO to ask them what they're going to do for the underserved?
No, we haven't yet. That's a really interesting idea.
That would be, you know, see if somebody is willing to answer questions and say, you know, we can't keep going the way we're going. Obviously, it's not working. So what are we going to do to address the issues for the underserved?
Do you have suggestions for who we might contact?
Well, you've got big hospitals up in
Oh.
Colorado Springs and Denver. I mean, the bottom line, that's where all the patients are being funneled to. So I'd like to know from them how they're going to help those of us who live in more rural communities and how they're going to help the underprivileged and underserved. I mean, these are, besides being citizens, and I know that our number of non-citizens are large, but how are we going to serve what are we going to change now that will help until we get a formal legislation going through to even the playing field? Hospitals have to start stepping up and, stop passing the buck.
Great. That's a great idea, Kathy. Thanks for that.
We've gone through 5 CEOs at Mercy Hospital. It's not
Wow.
worth doing somebody from Mercy
Okay.
because, they just go up the food chain and find another hospital. So you've got big medical centers up there. It would be nice to say which one of you wants to come and talk to us about the underfunded and what we can do about hospital cost.
That's a great idea. We'll sure try. If we can get that done for the 7th, awesome.
Well, in a few months, that would be great.
Or any other time in the future. But this task force does meet the first Tuesday of the month. So I hope you'll mark it on your calendar because again, collective voices speak louder. And you know, a rising tide lifts all boats. Any other cliches I can throw out? No? Okay. Thank you all for being here. Thank you especially to Jan and to the La Plata League. Take care. Happy New Year, and stay warm tomorrow during the snow. See you on the 7th.
Thank you so much,
Thanks,
y'all.
everyone.
Thank you. Take care.
Thank you.